run a hospital. நம்ம ஸ்டார்ட் பண்ணது by my parents. அப்பா அம்மா ஸ்டார்ட் பண்ணது 1957ல. அதுக்கப்புறம் we have now 209 hospitals. We have got 209 hospitals. Important என்ன இருக்குதுல, last year we opened 45 eye hospitals. Last year alone. And this year, first 6 months நம்ம ஓபன் பண்ணது 30 eye hospitals. இப்போ நீங்க கால்குலேட் பண்ணது இது ஆவரேஜ் என்ன இருக்கு நம்ம பண்ணது every week, every வாரம் ஒரு ஹாஸ்பிடல் ஓபன் பண்றது, which is very tough to do, but we are opening one hospital every week. Second thing நம்ம சொல்றது population wise. India population is 150 crores. Africa population is another 150 crores. இந்த ரெண்டு சேர்த்து நம்ம பார்க்கிறேன் 300 crores இருக்கு. நம்ம Agarwal Hospital is in India and in Africa in 10 countries. 10 countries நம்ம இருப்பீங்க. So நம்ம ஐடியா என்ன இருக்கீங்க, இவ்வளோ எக்ஸ்பான்ஷன் பண்ணலாம், இவ்வளோ வேலை நம்ம பண்ணலாம். சப்போஸ் நம்ம வெர்டிகல் growth பார்க்கிறேன், ஒரு சென்டர் பண்ணலாம். இப்போ அட்வான்டேஜ் இல்ல அகர்வால் ஹாஸ்பிட்டல் என்ன இருந்துச்சு, we don't have to get the inpatient facilities, so we can grow horizontally இவ்வளோ வேலை பண்ணலாம். And that is the best part of this growth. Since we are more than 700 eye doctors இப்போ நம்ம கிட்ட இருக்கு, we are more than 700 doctors working in Agarwal, and there are two ways நம்ம expansion பண்றது. One is called greenfield, that like in Chennai நம்ம நீங்க தெரியும் அலாம் hospital நம்ம இப்போ ஓபன் பண்றது. இப்போ இஞ்சி நகநல்லூர், I was talking to Mr. Balchandran Kale இப்போ நகநல்லூர் hospital, it is a greenfield. That is, we go start a hospital and does well. But suppose நம்ம மகாராஷ்டிரால first time open பண்றது, we go for acquisitions. அது நம்ம சொல்றது brownfield. So today we have got 15 hospitals in Mumbai alone and about 26 hospitals in Maharashtra totally. நான் எக்ஸாம்பிள் கொடுக்குறேன் அதை பற்றி. One more thing நம்ம understand பண்ணணும், இங்க innovations in healthcare extremely important. புது என்ன வருது, அதான் latest பண்ணணும். We have to get the latest stuff inside our center. இப்போ நம்ம தெரியும் எல்லா பேருக்கு இல்லைங்க, யார் கிட்ட அடிபட்டுச்சு சொந்த காலையில் கல்யாணம் பண்றது, father and mother, that the child leg sometimes is moving like this, rotate ஆகுது. இதெல்லாம் நம்ம கன் போட்டு உள்ள லென்ஸ் ஃபிக்ஸ் பண்றது, அது நம்மளோட glued IOL. Another technique is pinhole surgery. இதுல என்ன இருக்கு, suppose somebody has got a bad front window, cornea நம்ம சொல்ற டேமேஜ் இருக்கு, நம்ம pinhole மாதிரி பண்ணிட்டு கண்ணுல without eye transplantation patient can see. This is in a nutshell நம்ம Agarwal Eye Hospital growth plan. I will now request our CEO to tell you more about this public issue, the IPO and the details.
For us, it's a very proud moment to undergo this IPO journey. So we hope that we will make you all proud. And thank you all for supporting us over many decades to help us get to where we are. We have a quick presentation we're going to make on the IPO and a little bit about our company, our business model and what we do. Agarwal Eye Hospital Limited. We are India's largest eye care services chain with a network of 209 hospitals. We are India's largest and twice as big as our nearest competitor. The space that we operate in, which is the eye care services space, total market size is 37,800 crores. The reason this market is so big is because India has 275 million people who are affected by some form of visual impairment. We aim to serve that market. As I had mentioned, we have been operational for over 67 years. 67 years of trust, 67 years of focus and clinical work has established us as one of the most reputed brands in this field. Our business model is we call a hub and spoke model, and we will tell you how especially in Chennai, we have used the hub and spoke model. We also have a good approach to growing the business, how we look at setting up new centers. Financial performance, last 3 years, we have grown at a revenue of 38% every year, EBITDA of 42%, and our EBITDA margins are close to 30%. So to give you a little bit intro on the company, our services, I will require Dr. Anush to come in, our Chief Operating Officer, and then I will come back and I will explain our business model, and then Mr. Yashwant will cover the financial.
To build on what Chairman was saying and Ari was saying, 209 centers across India had close to 700 doctors and close to 1,600 paramedical staff. We saw close to 2 million patients walk in across all our hospitals just last year and performed over 2 lakh eye surgeries. Not a small number. This gave us 25% market share amongst corporate eye care clinics. The first hospital Father was talking about started in 1957. I think most of us from Chennai would have seen an eye hospital in the shape of an eye. Correct? That grew proudly and become 209 hospitals. This is spread across India. If you see the map on the left, lot of these centers are in south of India. We've also got a significant presence in west of India. I'm sure most of us here don't know, but in Maharashtra, we are the largest eye hospital team by far. Even in North India, in Punjab especially, we have some lovely hospitals. These contribute about 90% of the group revenue. If you look at the map on the right, Africa contributes to about 10% of group revenue, coming from around 16 hospitals. 65% of the group revenue comes from eye surgery. All of you might have heard Chairman in multiple press conferences talk about cataract surgery, blue dye. 65% of revenue comes from eye surgery. Close to 15% of revenue comes from outpatient consultation. 13% of revenue comes from optical retail. So every hospital has an optical shop. And 7% of revenue comes from pharmacy retail. You have a pharmacy retail store in every hospital. Others, only 13 to 15%. Rest is all unorganized. So this is where we believe a chain like ours can play a significant role. Our group has 25% of this market share right now. The main contributor to this business, like we were mentioning, is cataract surgeries, and we aim to do more cataracts and capture this particular market. If you look at our business model, we have 3 types of hospitals. The large hospitals are what we call the tertiary hospitals. Out of the 180 which we had launched in 31st March 2024, 26 were the large hospitals. Now they have grown to 28. Then we have 120 secondary hospitals, and the smallest format is called the eye clinics, and we have 55 of these right now. Now this is how we use the hub and spoke model to penetrate every city. That's the map of the city of Chennai. In Chennai alone, we have 21 hospitals. In 2 key areas, in Tenapet and Namaram, we have the large hospitals. And then all the key suburbs, Ashoknagar, Porur, Walmart, everywhere, we have smaller secondary hospitals. We try to bring quality eye care to everybody's doorstep. This is how we use hub and spoke model to enter every region. Bangalore, Hyderabad, Mumbai, wherever we go, we will use the same model which has worked for us in Chennai and Tamil Nadu to expand our network. So we do 2 types of expansion. In markets where the brand is well known, Tamil Nadu, Andhra, Telangana, Karnataka, we open our own hospitals. When we started to go in the north, when we started entering Mumbai, Gujarat, Punjab, we started buying out hospitals. Once we buy out the hospital, then we do a lot of upgradation. This is an example of a hospital with Dr. Natarajan, whose hospital we acquired in 2021, to significantly improve the infrastructure of the hospital and then make sure that we scale up the business as well. Using this strategy now, we have 15 hospitals in the city of Mumbai. It's a very proud thing for us that a Chennai-based company has a significant presence in Maharashtra. In Maharashtra, for example, we are the single largest player in eye care, and we have some very good doctors and we're doing very good work in the state of Maharashtra. Also, to maintain standard clinical protocols. Somebody was asking us earlier, how do you maintain quality protocols across the 209 hospitals? Here we have something which we call the clinical board, which actually helps you maintain standard clinical protocols across the globe. Our biggest strength is our doctors, and we have over 737 doctors who work with us right now, around the clock, full time, and these are the central pillars around which our business revolves. We have quality consultants across all specialties, across all our hospitals, and they are available to us on a full-time basis. We have close to 5,000 employees also who are working with us. So quickly, our board, we have a very strong board as well. Dr. Ranjan Pai, who is the chairman of Manipal, he's from Bangalore, he's on our board. Mr. K.V. Bala, who was the ex-CFO of Infosys, has been with us for quite some time now. He's the chairman of the audit committee. Mr. Nachiket Moore, who is the senior leader at ICICI Bank, is also with us. Ms. Archana Bhaskar, who is the CHRO in Dr. Reddy's laboratories on our board, and one representative from each of us investors. Now, to quickly give you a cover on the financials, I'm going to require Mr. Yashwant Shankar, our CFO, to come.
Good afternoon, everyone. Growth revenue வந்து 28% grow ஆகும் last 3 years. EBITDA just எங்களோட ஆப்ரேட்டிங் மார்ஜின்ஸ் எங்களோட ஆப்ரேட்டிங் மார்ஜின் பார்த்தீங்கன்னா 42% grow ஆகும். இந்தியாவில் பார்த்தீங்கன்னா எஸ்பெஷலி ஹெல்த் கேர் கம்பெனிஸில் ப்ராபப்ளி among the top few கம்பெனிஸாக இருக்கும் இந்த மாதிரி growth காமிச்சிருக்கேன். இந்த growth-ஓட ரெவன்யூ growth-ஓட காரணம் என்ன, ஆக்சுவலாக என்ன பண்ணியிருக்கோம்? பேஷண்ட்ஸ் பார்த்தீங்கன்னா நம்பர் ஆஃப் அதாவது வாக்கின்ஸ் அதுவும் எங்ககிட்ட வந்து நிறையா இன்க்ரீஸ் ஆகுது. எதுனாலும் பார்த்தீங்கன்னா இன் டர்ம்ஸ் ஆஃப் கிளினிக்கல் சர்வீஸ் மெயினாக எங்களோட டாக்டர்ஸ் சாரும் பேசியிருக்காரு. எங்களோட இன்னோவேஷன் டெக்னாலஜி எல்லாமே அதுக்கு ஒரு பெரிய ரீசன். அதே மாதிரி அடுத்தது பார்த்தீங்கன்னா FY 22ல் டோட்டலாக 106 ஃபெசிலிட்டிஸ் தான் இருக்குது எங்ககிட்ட, 106. அது வந்து 2 வருஷத்துல வந்து 180 ஆயிடுச்சு. அவ்வளோ ஃபெசிலிட்டிஸ் வந்து அக்ராஸ் இந்தியா நம்ம வந்து ஓப்பன் பண்ணியிருக்கோம். தமிழ்நாட்டிலும் நிறைய ஃபெசிலிட்டிஸ் வந்து ஓப்பன் பண்ணியிருக்கோம். இப்போ தமிழ்நாட்டிலே மொத்தமாக பார்த்தீங்கன்னா நாங்கள் எங்ககிட்ட வந்து கிட்டத்தட்ட 70 ஃபெசிலிட்டிஸ்க்கு மேலே ஆயிடுச்சு போன 3 வருஷத்துல. இதில் வந்து சின்ன சின்ன கிராமத்தில் கூட போய் ஐ கிளினிக்ஸ் வந்து நிறையா வந்து நாங்கள் வந்து ஓப்பன் பண்ணியிருக்கோம். ஸோ இந்த இன்னொரு 2 விஷயம் நான் ஜஸ்ட் வந்து இன்கம் ஸ்டேட்மெண்ட் பற்றி பேசுகிறேன். இன்கம் ஸ்டேட்மெண்ட்ல எங்களோட முக்கியமான இது என்னன்னு பார்த்தீங்கன்னா செலவு அப்படின்னு பார்த்தீங்கன்னா 2 விஷயம். ஒன்று வந்து நாங்கள் டாக்டர்ஸ் வந்து ஆக்சுவலாக என்ன பே பண்ணுறோம் ஒன்று. ரெண்டாவது வந்து மெட்டீரியல்ஸ். இந்த மெட்டீரியல்ஸ் அதாவது மெட்டீரியல்ஸ்ன்ற போது என்னன்னா கண்ணில் போடுற வந்து இன்ட்ராகுலர் லென்ஸஸ் சொல்லுவோம். அதே மாதிரி ஸ்பெக்ஸ் வாங்கும்போது அந்த ஃப்ரேம்ஸும் அந்த லென்ஸஸோட காஸ்ட் அதுவும் நாங்கள் எப்படி கண்ட்ரோல வச்சிருப்போம்னா இந்தியாஸ் லார்ஜஸ்ட் பிளேயர்ன்றதுனால எல்லா வெண்டர்ஸ்கிட்டையும் எங்ககிட்ட ஒரு நல்ல பேர் இருக்கு. அந்த நல்ல பேர்ல we deal with them in a very fair manner வந்து they believe. அதுக்கப்புறம் 2-3 ஜஸ்ட் சின்ன சின்ன ஹைலைட்ஸ் மட்டும் நான் டச் பண்றேன். ஒரு 4-5 வருஷத்துக்கு முன்னாடி பார்க்கும்போது அகர்வால் அப்படின்னா வந்து ஓகே இவங்க வந்து தமிழ்நாட்டில் மட்டும்தான் வந்து ஃபேமஸ் அப்படின்ற ஒரு தாட் இருந்தது. அந்த தாட்டை வந்து நாங்கள் ஒரு 3 வருஷத்துல உடைச்சிட்டோம். எப்படின்னு பார்த்தீங்கன்னா எங்களோட எக்ஸ்பென்ஷன் பார்த்தீங்கன்னா இந்த பை சார்ட் பார்க்கும்போது புரிஞ்சுட்டீங்க. நாங்கள் நிறைய ஃபெசிலிட்டிஸ் மகாராஷ்டிரா, குஜராத், பஞ்சாப் இந்த மாதிரி 3 ஸ்டேட்ல வந்து நிறைய எக்ஸ்பேண்ட் பண்ணியிருக்கோம். அதே சமயம் எங்களோட பிசினஸ் வந்து தெலுங்கானா, ஆந்திரா இங்கேயும் வந்து நிறைய வந்து இம்ப்ரூவ் பண்ணியிருக்கோம். ஸோ இப்போ இந்த நிலைமையில வந்து நாங்கள் எப்படி சொல்லலாம்னா we are like a pan-national true pan-national brand ஆகியோன்றது நாங்கள் நம்புகிறோம். ஜஸ்ட் உங்களுக்கு ஒரே ஒரு ஃபைனலாக வந்து நான் ஒன்றே மட்டும் சொல்கிறேன். இந்த ஐகேர் மார்க்கெட்டில் அதாவது ஐகேர் இண்டஸ்ட்ரியில் வந்து we are definitely India's largest eye care services provider. ஒன்று. ரெண்டாவது பார்த்தீங்கன்னா எங்களோட காம்படிஷனோட அட்லீஸ்ட் ஆல்மோஸ்ட் க்ளோஸ் டு டபுள் நாங்கள் எங்கள் காம்படிட்டரோட அதிகமாக இருக்கோம். 2. மூணாவது வந்து அதாவது நீங்கள் இந்த ஆர்கனைஸ்ட் பிளேயர்ஸில் எங்களோட மார்க்கெட் ஷேர் பார்த்தீங்கன்னா கிட்டத்தட்ட வந்து 25% மார்க்கெட் ஷேர் இருக்கு. வருஷம் இந்த மார்க்கெட் ஷேரும் அதிகமாகிட்டு இருக்கு. தேங்க்ஸ் டு ஆல் ஆஃப் யூ. இன்னொரு முக்கியமான விஷயம் பார்த்தீங்கன்னா எங்களோட லாங் ஸ்டாண்டிங் ஆப்ரேட்டிங் ஹிஸ்டரி, அதாவது சார் சொல்லியிருப்பாரு 1957 ஸ்டார்ட் பண்ணி 3 generations ஆல்மோஸ்ட் 4 generation ஆஃப் ஆப்தல்மாலஜிஸ்ட் வந்து இருக்காங்க. இன்னொரு முக்கியமான விஷயம், இந்த ஆப்தல்மாலஜி இண்டஸ்ட்ரியை பற்றி பார்க்கும்போது என்ன நீங்க புரிஞ்சுக்கணும்னா இட் இஸ் குவைட் அன்ஆர்கனைஸ்ட். ஸோ எங்களுக்கு வந்து we believe that எங்களுக்கு நல்ல ஆப்பர்ச்சுனிட்டி இருக்கு to actually make it a more of an organized kind of sector. This is what we believe. And last, what I would like to say is, we would continue to grow, and definitely we would continue to serve, and we strive to be the best eye care service provider in the country. Thank you.
But in your case, with a huge headroom for growth, how do you see the market share to grow?
Yeah, so thank you for questioning. So we see the organized segment, what we were saying is, overall eye care industry, the chains, which is any company which has more than one hospital, we call it a chain, has about 13 to 15% of the market share. The remaining 85% is with the neighborhood clinics, community-based hospitals, government hospitals, multi-specialty hospitals. If they have a department, they control the remaining 85%. But what is interesting is, in the last 4 years, this was about 8-9%. From 8-9% chains like ours, as we have grown, we have slowly started to increase that market share. So although we may not be able to increase the market share among the chains, there also we have seen a significant growth. The overall market contribution for the chains will continue to increase. And the reason for that is, especially after COVID, what is happening is, people are taking their health very, very seriously. So all the customers right now, all the patients want to go to quality institutions. They have stopped going as much to the neighborhood clinics. They like to go to quality institutions because of safety protocols and everything, which is why you are seeing this increase in the pie which the consolidated players are taking. So overall, as the market grows, the chains will take more market share, and in that we will continue to scale up as much as possible.
நான் கொஞ்சம் எக்ஸ்பேண்ட் பண்றேன் இதுல தமிழ்ல. See, இப்போ நம்ம கிட்ட எவ்வளோ சென்டர்ஸ் இருக்கு, 209 இருக்கு. பட் நம்ம திங்க் பண்ணா டெல்லியில இல்ல, உத்தரகாண்ட்ல இல்ல, சத்தீஸ்கர்ல இல்ல. நம்ம ஹாரிசான்டல் எக்ஸ்பேண்ட் பண்ண டைம்ல we can expand as much as we want. இவ்வளோ சென்டர் ஓபன் பண்ணலாம். நம்ம அட்வான்டேஜ் என்ன இருக்கு, நம்ம கிட்ட ஒரு பெரிய ஹாஸ்பிடல் ரூம்ஸ் எல்லாம் வேணாம், இன்பேஷன் ரூம்ஸ் வேணாம். We are asset light, as Yashwant correctly used the word asset light. See, hub and spoke asset light. Another word is this hub and spoke model. இப்போ சென்னையில மேல் ஹாஸ்பிடல் எல்லா பேருக்கும் தெரியும். இப்போ சரௌண்டிங் இருக்கு, நகர்ல இருக்கு, எல்லாம் கேட்ராக்ட் ஆகுது, எல்லாம் போடுது. சப்போஸ் யாருக்கு காம்ப்ளிகேஷன் அங்கே இருக்கு, they will come to the main hospital. Suppose you say, okay, I want some tough surgery, அங்கே இருக்கு, come to the main hospital. So this hub and spoke model works extremely nicely and comfortably. இப்போ நமக்கு சென்னையில 21 இருக்கு, 21 hospitals இருக்கு. அதுல நமக்கு ரெண்டு மெயின் ஹாஸ்பிடல்ஸ் இருக்கு, வேளச்சேரியில இருக்கு, மெயின் ஹாஸ்பிடல் சென்னையில இருக்கு, and we can get lot of scope of growth this way.
One more question.
Sir, one more.
Yes, Malcolm.
Sir, in this expansion, both organic and inorganic, how do you view the inorganic part of it? Will it be little expensive, or organic will be expensive because the headroom in terms of single hospitals will be more? But which model do you think will be viable in this?
So our group is built on an organic model, especially in markets where the brand is strong. Like I was saying, Tamil Nadu, all the other states. Now we also consider Maharashtra core market. The acquisition is used to enter a new market. When we are entering a new market, we will acquire. Once you acquire a large hospital, then surrounding that hospital, like Sir was mentioning, we set up these smaller hospitals to bring in more patients, more surgeries to the main hospital. So acquisition is a strategy used to enter a new market. You create a beachhead, and then you set up more feeder centers to funnel more patients into that hospital. That's how we work.
So it's been a viable one, right? So far.
Yes, works very well. So in the last 6 months alone, we have launched 30 new hospitals. Among these 30 hospitals, 5 were acquisitions, and the remaining 25 were all organic.
So to add to this, what Dr. Anil said is, if suppose Bombay, they already got 15 hospitals. The brand is established. So now we have opened Kalyan, a new center which is totally greenfield. UP we opened just now, Varanasi, first hospital. That's again an acquisition. So this combination makes a big success story.
Sir, how?
Yeah, continue. I can't see because it's live, but that's the matter. Continue, please.
Sir, how much you are going to raise in this issue? That is the first thing. The second thing is, what are the areas that you are going to invest through this rise? The second, that was, will you be able to touch that 300 mark of facilities by this year, this financial year again?
Sure.
I have 2 more questions at this time.
Sure. So the answer to the first part of your question, the IPO size is 3,000 crores, 3,062 to be precise. Out of this, 300 crores is the primary raise. This 300 crores will come into the company. The remaining 2,762 crores is secondary, in which the existing shareholders will be exit some of the money. This 300 crores will be used. Firstly, out of the 300 crores, 195 crores will be used to reduce the debt. We have a total net debt, gross debt of 373 crores to reduce the debt. And the remaining 105 crores will be used to expand. We also have certain amount of cash on the company. But like our CFO was mentioning, we are a very profitable company, so we generate a lot of cash. That cash we will utilize to expand and set up more centers. In terms of your second question, which is will we get to 300? Right now we are at 209. We believe that we will continue to look at more opportunities as we continue to expand. At some point, hopefully, we should get to that coveted 300.
By end of this financial, end of FY 26?
We don't know that yet, sir, because we don't have an insight onto that many, because from 209 to 300 is 91 more hospitals.
Exactly.
So that will take its own time, but we continue to look at new markets, new geographies, new centers. Identification also takes a little bit of time. So we will continue to expand our network.
Last question, sir. What was your revenue in FY 24 in terms of crores, and how much you are looking at by the end of this financial year, FY 25?
So I'll just request Mr. Yashwant Venkat to just give you an update on the financials.
FY 22, our revenue was 693 crores. For the first half of this year, FY 22 693 crores, FY 24 1,332 crores, just the revenue. For the first half of this year, we are at close to 820 crores. See, one important point which I want to make here is in terms of the business cyclicality, about close to 45% of the business comes in the first half, 55% of the business comes in the second half. So probably with that, I think you can definitely make a gross estimate of where our revenue will be at the end of this year.
Also, what kind of investment goes into each of these centers? Generally, what kind of allocations do you make? And also, you seem to be focusing more on Africa. Are there any other international markets you're looking at now?
Sure. So I'll take the second part of the question, which is on Africa. Africa now, we have 16 hospitals in Africa, and we have 193 hospitals in India. If you see, Africa as a percentage of revenue has been coming down because India, the opportunity is immense for us. So we as a company are focused predominantly on growing in India. Africa, we have few very good hospitals which we have set up, but we will continue to operate those and maintain those. Many of these countries are the only eye hospital. For example, in Mauritius we have an eye hospital. In Mozambique we have an eye hospital. In Kenya we have an eye hospital. Many Indian doctors from Tamil Nadu and from other places go there and they live there and they do very good work. But Africa will not see that much of revenue potential. It will predominantly growth will come from India, at least for the next foreseeable future. On the
How you are going to claim profits here? IPO process, how you are going to...
Sure. Let's finish off the first question on the investment, and then I will just come back.
Yeah. So just adding on to what Dr. Adil said, see, our predominant focus is on India growth. As explained to you, we have grown on an overall basis at about 38.3% from FY 22 to FY 24. Here, if you just have to split up the growth, we have grown at nearly 43% in India and about 13.5% in Africa. So you can definitely understand that our focus is on India, but Africa growth has also been quite good at around 13.5%. Now coming to the second part of the question, see, we have three kinds of facilities. Primary, the very basic facilities which don't have an operating theatre, otherwise called as Agarwal Eye Clinics. In terms of capex for those primary facilities, it is between 30 to 35 lakhs. That is because of the fact that as
In terms of square feet area also, they are between 750 up to 1,500 square feet. Now coming to the next type of facility, which is the secondary facility. That is secondary facility, again the investment varies between 4.5 up to 7 crores. Again, the square feet area also between 4,000 to 7,000 square feet. This is the overall India average, excluding Bombay. And the third is the tertiary care facilities, where generally tertiary care facilities are greater than 8,000 square feet in size. And again, an average between 10 to 12 crores in terms of investment per tertiary care facility.
How are going to replace the IPO process?
So the IPO proceeds is of 300 crores, which is primarily into the company. So the company will get 300 crores. Out of this 300 crores, 195 crores will be used to retire debt. So this current debt, which is 373 crores, will come down by 195 crores. So we'll be less than 200 crores of gross debt, which is a very, very healthy number for us. The remaining 105 crores will be utilized for general corporate purposes and expansion and setting up, bringing in new equipment, new technologies, and setting up new centers in different markets, predominantly in India.
So what kind of investment are you looking at in technology? Because AI is playing a major role in healthcare and other sectors. So also, what kind of role is AI playing in the IPS sector? Probably elaborate on that.
Sure. I will request Dr. Anush to give you an update on what all we are doing from a technology perspective. Then we can talk a little bit about AI.
Okay. In terms of technology, we think of technology two aspects. The most important technology for us is the technology that's available to the doctors to service the patient. So the quality of the medical equipment is absolutely gold standard. To make a successful hospital, we've seen unless you get the best doctors, nothing works. Regardless of the machine, the first primary incentive for us, the best doctors possible. They have to be supported by quality paramedical staff, whether it's OT technicians or optical staff. It's the first parameter. The second thing you learn is you have to support them with gold standard medical equipment. Now, in medical equipment, as of today, AI has a very minimal role in terms of commercially available medical equipment. What is available in the future is potentially there. We are all monitoring it very closely as a group, and that's something our doctor teams travel across the world regularly to make sure they're updated with all the quality technology available in the market. And what we pride ourselves with is we want to make that technology, even though it's expensive, available at the doorstep of the patients, not just in the metro city, but also in tier 2, tier 3, tier 4 towns, where they need it the most. What we hope for AI will do is give us access to villages where to get a doctor or a paramedical staff to live is very hard, but our family wants to continue to make it accessible. The second part of technology is also important, where AI can play a role today, which is what is commercially available, is to improve the productivity of the doctors and paramedical staff. Gone are the days where paramedical staff and doctors used to spend hours and hours writing about the medical diagnosis. So today, if you come to Agarwal Hospital, any patient who visits the hospital and leaves the hospital gets a beautiful patient-friendly report. What that means is all of you would have visited a doctor. Doctor told you your diagnosis is X, your treatment is Y, and you have to go and discuss with your family. You will forget what the doctor said. If they give you a report, it will be printed. Medical jargon is very difficult for patients to understand. We have launched a beautiful app that gives you local language translated medical report in a common man language. So if you go to any Agarwal hospital, if you click a button on the app, you want it in Tamil, in Telugu, in Kannada, in Malayalam. This is possible because of the quality of the software available. So these are the two examples of software.
So I have market share is high, whether it's in organic setup area or inorganic setup area.
This is the question.
Where you are strong in market share?
Is it organic or inorganic? We have both combinations, So we do both inorganic and organic, but most likely we prefer to go organic. Inorganic, we are going for acquisition in some areas, some of our full stakeholders. we're opening a new state in Maharashtra. That time we opened. That took for some time only. Then by the time the brand has become strong, we go inorganic, organic.
So how do you see the revenue mix going forward? 78 versus 20,
Yes.
I services versus products.
Yes.
Because product segment is also increasing, as you pointed out. So will the same revenue mix continue or will it change going forward?
So I think the last 3-4 years, the last 4 years, we've seen a similar trend. You see that about 65-64% is coming from servicing. The remaining is coming from products, 20% is from products, and the remaining is from investigation. We believe that the trend will be similar. So if you see the trend in the first 6 months is approximately going to stay that way. So 65% of the business will come from servicing. So in servicing, you see, capital services will be 76%. The rest will come from products, sale of products, which is glasses and lenses. The rest will come from sale of pharmacy products. It will stay the same.
Sir, in 2023, you raised $80 million US.
Yes.
From RTP.
Yes.
So anything in the pipeline for this year, regular calendar year, CY 2023, apart from this IPO issue?
Nothing else. I think from an IPO perspective, we are very comfortable that 300 crores will suffice at least our plans for the next 3 to 4 years. We don't look at doing any fundraise. And I think the advantage is because our business generates whatever profit we generate, 85% of that becomes converted into cash. So we are very cash flow positive, and we are utilizing whatever cash the company generates to set up more hospitals. So we don't believe we will require any more additional capital.
Is there any pre-IPO placement?
No, there's no pre-IPO placement. Directly, our listing is planned for Jan 29th to Jan 31st. Next week, Wednesday to Friday is when the issue will be open, and we're actually planning a listing on NSE next Wednesday, which is February 5th.
Yeah. See, just to add on to what Dr. Rajal was saying, as of September 30, 2024, in terms of cash equivalents and investments, we have close to about 490 crores. And as explained earlier, the gross debt as of September 30 was close to about 373 crores. So we have been net cash positive. And with the IPO proceeds also, we've pared down debt to the tune of about 195 crores. And with the internal accruals, we can continue our expansion.
This IPO, are you allocating some portions to the employees?
Yes, sure.
Yes.
How much?
I have to come back to you on the right number.
But there's a good employee reservation quota. I think it is close to 1% will be reserved for employee quota. So all the employees will be able to subscribe. But the exact number, after the meeting, we will just give it to you.
Okay.
So
now, if the questions are done, what I will request is for the Motilal Oswal team to give us the closing remarks, followed by we have time for TV channels to take bites from Dr. Amar and the dignitaries here. That will take up after the closing.
The main book for all categories opens on 29th Jan and closes on 31st January. The estimated listing date is around 5th Feb. We look forward for your support to make this IPO brand success.